thank you all for joining us. I know how many demands we all have on the most important commodity we really have, which is our time. So I'm grateful you'd take time out and spend the hour with us. Just a little background, this webinar came about rather selfishly as my father a couple years ago got diagnosed with mild dementia and started falling. And there's probably nothing more humbling than being a researcher in falls, geriatric care, and then having your father not really follow any of the advice that you have. Also, just watching my mother sort of enter this new phase as somebody who was running a company up until recently and now is just wrapped with the burden of being a caregiver. So I wonder, how are other people doing this? How are other people dealing with this chapter of life? And what I love about the SAM community is really you just don't have to go far. So you find experts in this field and really also people who are willing to share their experiences to really just be a gift to the rest of us in the community. So I wanted to just first thank HM and ADAM for co-sponsoring this, as well as Melissa and SAM and Dr. Anita Chari for helping organize this, and Wade, who's also helping from SAM with the tech support. Just briefly about logistics, we'll start with Dr. Ahmed and then proceed with Dr. Goldberg and Dr. Kaji, and then really follow with Q&A. So feel free to answer some questions in the chat. And with that, I just want to thank and really just reiterate that it's an honor to hear the stories of these amazing colleagues. And they're really going to share something personal in what is really a painful part of these chapters of life. And unfortunately, we will either have faced them or we'll face them in the future. So I can't underline or underscore how much we really are grateful for all of them sharing this. So I'll first start with the introduction for Dr. Ahmed. She's originally from Louisville, Kentucky, and graduated from Emory University in Atlanta, Georgia, with a Bachelor of Science in Biology and Spanish. She received her MD from the University of Louisville and then completed a 5-year emergency medicine and internal medicine residency at the State University of New York in Downstate Health Sciences University, or SUNY DHSU, and Kings County Hospital Center in Brooklyn, New York. She is double board certified in emergency medicine and internal medicine, and then completed a geriatric emergency medicine fellowship at Weill Cornell New York Presbyterian Hospital in New York City. She has been a AGEM executive committee member for 3 years, first as a member at large, and then as a treasurer, and now as a secretary. And all this was juggling, taking care of patients in a public inner city level 1 trauma center and tertiary cancer center in Brooklyn in New York, but also spending time taking care of her father. Interested in how to best optimize the care of older adults in the ED, including prioritizing communication between patients and families, as well as addressing the comfort and mental and physical issues that these patients and their family members are experiencing. So without further ado, Dr. Ahmed.
Thank you so much, Sean. Thank you for having me. I just want to say overall that I'm very grateful for AM and AGEM over the years. It's been a really wonderful part of my career. And also to Sean, again, because she was my first mentor in AGEM and SAM when I was still a resident at SUNY Downstate Kings County. So thank you for that introduction. Overall, I just want to share a little bit about kind of my experience and some things I've learned over the last couple years. And in general, it's kind of difficult to put into words, little things, but I'm just going to share what strikes me most about things I've experienced. My father actually passed away about 15 months ago after struggling with congestive heart failure. Basically, over a period of 6 months to a year, it was a rapid decline. And I'm just very grateful overall for the support of family and colleagues. And overall, I feel like the things I've learned from this, it's how we handle this type of event is unknown until it occurs. And we can never adequately or exactly prepare for this moment. And I know for myself, this was the first time I ever lost anyone close to me. And my father immigrated from Pakistan. He was a general and vascular surgeon in Kentucky and Indiana. And he did his medical school training in Pakistan and then did his general surgery training in America and became a general and vascular surgeon. So he was really an inspiration for me to go into medicine. And I feel like having that sort of behind me and knowing he inspired me and instilled in me all my reason for doing what I'm doing and inspiring me really propelled me and allowed me to continue on around that time and just to continue moving forward. And I'm just very grateful for that and everything that he taught me and I learned from him. Overall, the big lessons that really strike me are when you're in an organization, don't be afraid to ask for time off. Don't be afraid to advocate and put yourself and your family first at that time, even if it's a new environment. I feel like one thing in that moment, you want to do the best, you want to be there, you want to show up, but it's those those moments you can't get back. And when I look back, I'm just most grateful for some of the time between fellowship and my attending year where I took the summer off. And so I was able to spend time with my dad for almost the whole summer. And those memories really stick with me. Just the little things that I go back to and then videos I have. It's just invaluable that time, and learned so much about him, even more than I knew in that summer as well. I feel in the acute setting of the hospital or ICU, it's balancing being a daughter and doctor at the same time was something I can't put into words. It's just looking back, it's being able to kind of separate and having faith in the doctors that are taking care of your family member. And it's so much easier said than done, because that time we take care of patients when we're taking care of patients. And that time is part of the precious treasure time that we can spend with our family member. And being able to balance both of that as much as possible is something that I wish I could give easy tips on it. Because for me, it was something I struggled with a lot in terms of, just not questioning things that were happening and that kind of thing, and just trying to spend the time that you can with your family member. It's one thing, everyone's situation is different, and it's not easy if a family member doesn't have advance directives, and having all of that is not always going to happen. Sometimes family members, especially my own, didn't really want to talk about it too much. And he actually, no matter what we kind of asked him, he didn't want to write anything down. So that made it very difficult. Having known everything in practice that we do, and then knowing that, it made it very difficult. But it's sort of just realizing that everyone's situation is unique and different, and having to really go with what your family member tells you and wants. And sometimes it's not going to be clear cut, but just trying to really optimize their experience. And one thing looking back, when I think about everything, it's really giving them and not being afraid to let go and embracing palliative if that's offered, and really enhancing their experience and making them feel as comfortable as possible, and letting them have everything they want or ask for in that moment, but without also balancing our self and self-care. I don't regret any of the time that I spent away, because I have all that time back now. And I'm just really grateful for the time that I spent with him. I think it's just important, just a side note, sometimes when we make a decision about our career, we pick what we think is most comforting to us in the moment. For me, I was always in academics. I value academics. And I think that for me, I knew that would be an environment most comfortable for me during the acute period of illness that my father was going through. And I had a career opportunity, and I took it without really thinking exactly about the fit for me and whether it was the right fit for me. And I think that's an important thing to think about too. Sometimes a decision is right in the moment and for a certain period of time. And then when you have a moment or experience an acute event, you realize that one thing that I personally realized was I started valuing my own achievements and what I had accomplished on my own, and thinking about myself as separate from an organization. And that helped me advocate for myself to think about where career long term, where I fit best. And I'm actually thinking exactly right now about how I want to use my emergency medicine and internal medicine, and how to combine both academically, and really excited about the career opportunities and thinking about exactly what the right fit is for me. So that's something else that I think that might be right in the moment, and what might be perfectly great for a period of time. Things change, and you have to make the best decision for yourself. And I'm so very grateful for being able to have this time to find the right fit for me. There's so much more that I wanted to say as well, but I think that's probably good for now. Thank you guys so much for having me.
Thank you, Dr. Ahmed. I know this has been a really rough several years, because I met you maybe 4 or 5 years ago, and just to observe you kind of making all those decisions about career and finishing geriatric emergency medicine fellowship and where to go next, and the struggle with where do you practice. These are all decisions, and it's good to know that nothing is permanent, right? Like, you can get a job and you can decide that this doesn't work for this time of life. So thank you for sharing. I'm sure many people have questions that we can address at the end. But our next speaker is Dr. Liz Goldberg, who is an emergency medicine physician and associate professor of emergency medicine at the University of Colorado School of Medicine. She's an alumni of Brown University's postdoctoral research fellowship in AHRQ T32 in the Center of Gerontology and Healthcare Research, and has a master's in epidemiology. During her fellowship, she received an R03 from the NIA to facilitate her transition to aging research, and designed and pilot tested a falls prevention program for older emergency department patients, which is now considered a national model for ED fall evaluation and treatment. And she subsequently received the prestigious Beeson Career Development Award to continue her work with the larger trial of the Gap Care using the Apple Watch for fall outcome assessments. She's also received funding from Blue Cross Blue Shield of Rhode Island to implement EQUIPPED, which is the enhancing the quality of prescribing practices for older patients discharged from the emergency department. And additionally, Dr. Goldwood was the co-founder of the My COVID Risk app, a publicly available tool that was used over 1 million times by individuals looking to better understand their risk of the dreaded COVID infection. Dr. Goldberg is the current president of AGEM, the Academy for Geriatric Emergency Medicine for the Society of Academic Emergency Medicine. And in this capacity, she works with 120 awesome academic clinicians interested in geriatric emergency care in the United States through clinical quality improvement, research, education, and advocacy. And I think above all that is balancing having 4 kids now. So we're delighted to hear about her story.
Thank you, Shauna. That was such a nice introduction, and I'm delighted to be here and see so many people from AWEM and from AGEM and in emergency medicine. And I'll just start by saying that if you are taking care of children or older adults, you are a hero. This is hard work to do in addition to working full time and with all the demands of academia. And I hope I can share how valuable it is to spend that time with your older parent or child that is sick. My experience is in some ways very similar to Dr. Ahmed's and in some ways also very different. So my mother was diagnosed with breast cancer at the age of 47 and then had breast cancer for 5 years, during which she was very vibrant and young and still premenopausal, and then died at 52. And I will share, I was the only one that was with her when she died, and she died in her home, and she died when she was ready to. One of the things that she did for me and for our family members that really made this journey much easier is she, at the end, said that she was ready. She was still very young, but she said that she was done with the suffering and she was grateful to have to look forward to a time when she was no longer suffering. And I'll also share, so I was actually in college and my mother and I grew up in Berlin in Germany, and I knew I wanted to go into medicine. And so I went to Miami University of Ohio for college, and she was still located in Europe. So I want to speak to a little bit about caring for an older family member that is not in your state or even in your country, because I think many of us face this dilemma, and it's a real challenge because how do you stay connected? How are you helpful? How do you know when the time has come where you have to say, I have to stop my current life and put a pause in and move?
So I was in college and I was doing a pretty rigorous pre-med curriculum, and it was very challenging, we'll say, as the oldest daughter of 3 kids, to stay focused on studying and this very rigorous curriculum while my mother was sick. But she was initially diagnosed with breast cancer. They did surgery, she did chemotherapy. I was in high school and I was with her at the time. And then she reached a kind of a plateau where we thought that she was going to be going into remission. And then I will still remember the day really well. I got a phone call right about a week before I was starting my senior year of college. And my father said, my father's non-medical, he has an MBA, he was like a executive for an international company at the time in Berlin. And he called me and he said, I don't want to alarm you, but your mother is on morphine now. And at the time I wasn't medical, but I knew this was bad. And my father never calls me and gives me bad updates. And he's like, I don't want you to stop your studies. It's really important to you and your mother that you continue doing what you do. And I know that this, you're trying to get your GPA up. I know that that's hard and this is really important. And then the conversation ended. And I reached out to my girlfriend whose mother had died of breast cancer. And this is where I got the best advice that I've gotten throughout this entire journey. And she said, you will never, ever regret spending the last weeks of your mother's life with her. That was some of the most important time we had. And at the time I was also studying. I was busy. I had my life. I was about to marry this man. I had so many things that I just felt like I could not take time away from, but I was there with my mom when she died. And that was
has been meaningful for me throughout my entire life. And I'm a rule follower, and the idea of pausing studies was just not something that I could imagine for myself, because I always knew I was going to go to undergraduate, I was going to go right through to medical school, I was going to be a physician, and I was going to do step A, B, C as literally as possible. And I remember at the time you had to go to like health services to get a leave of absence from school. And I went to health services. I never had any interactions with any mental health professionals before. And at one point they asked me, like, how are you doing about this? And I just started crying, and I was just grateful for that permission. So I would say, as people that are supporting others that are going through this, allowing them to have that permission to just say, this is really hard, how are you doing? And to just listen, I think was extremely important for me at that point in time, as well as hearing from someone that I cared about very much, that you have permission to take time off from your busy life and go and be with your mother. And so my sister was actually at the same university as me, and I went to her right before I flew back home to Berlin. And I said, Charlotte, do you want me to call you if it's really bad? Do you want to come back too? And she was like, absolutely not. And I was like, you're going to come to the funeral, right? And she's like, I don't know. And it just became really obvious to me at that moment that you might have siblings who you've grown up with and you know and you love, but everyone deals with grief so differently. And there will be people that are in denial and don't want to hear about it and don't want to talk to you about it. And it will hurt because you want to talk about it. You want them to be there to support you and support the person you love. But not everyone is going to respond the same way. And I knew at that moment when my sister told me that it was not going to be helpful for me to try to reason with her and be like, hey, you really want to be here? You know, you can take time off school. I can help you. I knew that wasn't helpful because that's not the way she saw it. So I flew back to Berlin at that time. And the minute I saw my mom, I knew something was not good. She was a little jaundiced. And I had just seen her in the summer a couple of weeks prior, and there was a noticeable decline. And it's the first time I saw my mom as this not like vibrant woman going to operas in Berlin and Philharmonic and pulling us into all the like cultural opportunities that were available in Europe. And to my parents' credit, this is good advice if you have young adults or children, they never asked me to take on any caretaking at all. They did not want me to do everything for her, and they really just allowed me to decide what I could take on, which I know is unique and would have been probably very different if I had been, in my 40s then when my mother was sick. But I started driving her to all her doctor's appointments, and she had a pretty long hospitalization. I was there at her side, and I was actually shocked. My mother was someone with a lot of friends, but at the end, when you get very sick, there's a lot of people that don't know how to interact with you. And I was very surprised at how few people were sort of left standing at the end. And she had a 5-year journey with cancer, but really wasn't ill until the last 2 or 3 months. And it was pretty shocking. So I think you should prepare potentially to find yourself as the one key champion of your ill family member, because a lot of people don't know how to approach you once it's clear that you're going to die. It's a different thing if you have cancer and you're still doing chemo and there's a chance for cure. But once you've shared with your friends and family that you're going to die, I think there's very few people that know how to keep going in a close relationship. And you're going to find yourself bearing a lot of the weight of that without many people necessarily to talk to. So that was kind of a really eye-opening moment for me. And I will say, before my mom died, it was clear to both my dad and I that she was going to die. My brother was only 16, he was still in the home. So I was also kind of responsible for chatting with him and distracting him and kind of keeping life going for this teenager in the home. And he was also more in the denial side of things. He took on a role in a major musical. He was gone a lot. He was actually gone when my mother died. And about 2 days before my mom died, actually one key thing that I forgot, and this is important, about 50% of people nowadays don't die in their homes, although most do want to die in their homes. And I went to see my dentist at one point because I was back from college and I was like, I might as well get these things over with. And I went to my dentist and I told him my mom wasn't doing well. And he handed me this business card. And he's like, we did home hospice for my mom when she was sick. And it was the best decision we ever made. And at the time, I knew nothing about hospice. And he's like, but we were carting my mom back and forth from the hospital and to all these appointments. And she was tired of it. And we were tired of it. And it was just the exact right timing where we needed to get this information. He says, just call them and see what they can do for your mom. And couple of days later, when it was clear that she was getting really sick and she was on escalating doses of morphine and medication at home, this wonderful, warm Filipino doctor came to our home and he said, "This is how I'd like to prepare you. We can hook her up to a pump at the time that she's ready. These are the medications she can take for anxiety and pain. You don't have to go back to the hospital. We know what's going to happen here." And so when we were ready, we called them and they came and they hooked her up to a morphine pump. And the night before, she was very restless and my dad had to give her extra morphine at night. And then she was nonverbal like the last day. And I knew that she was going to die soon. And I laid in bed next to her and I felt it actually the moment that she died. And I was with her, but there was a calm kind of in our home because we're Catholic and our last rites were led to her 2 days before. And she had told us, "I want this. I don't want to suffer anymore. I'm ready for it." And even though I was sad, that was just so key for her to say because it was no longer a struggle and a fight. It was like, okay, we're ready. And forever, I'm just grateful that I made that decision to move back home and be there by her side because I know I was a comfort to her in her last moments. And so many wonderful things have happened to my life since then. And I think I'll just share one thing that happened. So she died and we had a funeral and everyone from our school community came to the funeral. And fortunately, she had met my husband, who's my now husband now, and it said that he's a wonderful man. I got married to Zach and we had 4 children and I got into medical school a month after she died. She never knew, but I think she knew kind of. And then on my first month in residency, I was in the NICU. I had a patient with advanced esophageal cancer. He just started hemorrhaging and it was clear that he was going to die. And the ICU fellow was like, "Liz, do you want to talk to the family about goals of care?" And after I had this discussion with the family, the way that I would want someone to talk to me, the ICU fellow pulled me aside and she's like, "I can't believe how well you just did that. That's just so incredible." And at that moment, I knew I needed to do geriatrics or palliative care or go into this specialty because I've had this really unique experience and felt what it's like to be a caretaker and felt how important it is to have home hospice and have people talk to you like death is a reality, but we can make it as best as possible. And it's really shaped my entire academic career from that point on. And that's why I have such passion for improving how we care for older adults and those that are dying. So just the key things I want to impart is young adults are capable of a lot. I was 21 when my mother died. Don't underestimate how much they may want to be involved with this process and want to be helpful at that point in life and how much it might influence their future career trajectory. I think being that person that knows about death, I mean, everybody here is a physician or is involved with clinical care somehow. You are a unique person to support others that might be at the point where they know their family member or their loved one is dying, and you're someone who's experienced death in person. That's a really unique skill, and you can come from a place when you talk to others that both shares caring and gives them permission to grieve about it, but also death doesn't have to be an awful thing. Death is often welcomed, right, at the end, especially if you've had a long trajectory of suffering and such. So I always try to impart that on my patients and also on my friends that ever have sick or dying family members. You may be the only one standing at that point in time that is ready to give that advice or ready to talk to you about that uncomfortable topic of death. And finally, trying, even if they won't agree to put anything in writing, trying to clarify, what are your last wishes? My mom made it so easy for us. So she's like, "This is what I want at my funeral. I don't want to be under the ground. Just don't do that. Put me in an urn. These are the people I want there." And that was exceptionally helpful just to have an idea of what she wanted and be able to follow that path. And yeah, so it's impossible to prepare really for that chapter in life. But I think many of us here, since we've witnessed it before, are really well prepared and just have that courage to stop whatever you're doing and be there with that person because those memories last a lifetime and you'll always feel like you had those treasured moments with that person you love.
Thank you, Dr. Goldberg. I think I'm being a bad moderator. We should have gotten tissue because I'm just choked up about the experience and just how you eloquently shared that and just really how you epitomize just resilience and sort of relish or really savoring that time with your mom and really how it just impacted your amazingly successful career. So thank you to your mom for leading you to impacting all of geriatric emergency medicine with your amazing work. So thank you for sharing. So next we'll go to Dr. Amy Kaji. who is the Senior Advisor for Academic Affairs in the Department of Emergency Medicine at Harbor UCLA, David Geffen School of Medicine at UCLA. She completed her residency training at Harbor UCLA in 2002 and then completed a fellowship in research and disaster medicine. And at the same time, achieved a PhD in epidemiology at UCLA School of Public Health. She focuses on research methodology and has been fortunate to serve as the statistical and methodological consultant for various projects and has authored or co-authored an amazing 170 peer-reviewed publications. She also serves as a statistical and methodological editor for Annals of Emergency Medicine and JAMA Surgery. And because of her love of writing, she served as one of the section editors for Rosen's 10th edition of Emergency Medicine's textbook. She is also the past president of SAM and an active member of the Scientific Review Committee for the ACIP Research Committee. So looking forward to hear about your incredible journey, Dr. Kaji, while you were the president of SAM and dealing with your parents becoming ill. So thank you, Dr. Kaji.
Thank you so much for your kind introduction, Chan. And I am so touched by both Dr. Goldberg and Dr. Ahmed's story, and I'm grateful to be a part of this panel. My story is similar in many ways to both Dr. Ahmed and Dr. Goldberg, but my story begins in 2020 after the pandemic began and the stay-at-home order was implemented. And I would say that it continues until May of last year. My 91-year-old mother, who is an amazing tenured professor in pharmacology at a medical school, and still did bench research at 90. Couldn't cope with the isolation of COVID. She was at a loss because she stopped having much of the social interaction she had previously had when she went to the office and the lab on a daily basis. Her appetite became poor. She didn't want to get out of bed. She started complaining of muscle aches and bone pain, and she began to lose a lot of weight. She began to then develop an unsteady gait, and she sustained multiple falls. At that time, my father, who was living with her, and my oldest brother, who was kind enough to live with them to take care of them, called me several times, expressing concern that she was becoming mentally confused, where she had numerous episodes where she would wake from sleep and she was hallucinating about insects and strangers in the home, and she called the police. And then in June of 2020, my mom fell while she was walking and sustained a hip fracture, a vertebral fracture, and some rib fracture. And when I visited her in the hospital as well as rehabilitation, it was pretty clear to me that she was having paranoid delusions because she was accusing my 93-year-old father of adultery, stealing her money, et cetera, et cetera. A neurologist then diagnosed her with Lewy body dementia. And at that time, I was daughter/doctor, and I was thinking normal pressure hydrocephalus and was upset that no one would do her LP. But anyway, she had a lot of sundowning in the hospital and she was prescribed antiplacent sulfatrine. And unfortunately, we couldn't keep her at home because she was violent towards my 93-year-old father as well as my oldest brother. And she began to hit the nurses and the phlebotomist who would need to draw her blood. She refused physical therapy. And this is a stark contrast to the gentle, kind woman I knew and loved. And after a short stay in rehabilitation, she was discharged to her home initially, where we ideally wanted to keep her, but then she fell again and had another vertebral fracture, then had urinary tract infections, and then presented with delirium. She had to keep going back and forth to the hospital for urinary tract infection.
And for her own safety as well as my father's, she was placed in a memory care unit.
In the beginning, we were able to visit her pretty often and, in fact, every day. When I was there visiting Philadelphia, which gets to Dr. Goldberg's point about cross-country travel. I live in California and I had to keep going back and forth. But after we had a lot of COVID surges and then we couldn't actually go into the nursing home, when we finally were able to see her after about a 2-week hiatus, she was just staring emptily at the TV. She rarely interacted with the other residents and she wouldn't get up. So then she became bedbound. She started developing contractures, and this happened so quickly. It's really unbelievable how quickly contractures can occur. She then developed a decubitus ulcer, and then she got sacral osteomyelitis, she got septic, and then she had pneumonia and respiratory failure. Knowing what I know about medicine, and my brother was a cardiologist, both of us were, of course, wanting her to go to hospice and palliative care. But my father really felt that she would want to fight and would not make her DNR and did not want her extubated. And this was really hard for both my brother and me who had a medical background. I have two other siblings that don't have a medical background, and they were really more towards doing everything and in complete denial that my mother would return to her old self. Finally, after many family conferences, my father agreed to the extubation, and within an hour, she died on January 18th. So I just recently had the 1 year anniversary because my mom died last year. Unfortunately, subsequent to that, my father rapidly began to decline. He developed abdominal pain, went to the hospital. He had abnormal liver function tests and then had a CT that demonstrated a pancreatic mass, and was an amazing 93-year-old in that he swam every day, walked over a mile every day, and was still doing research. They did research together, but my father quickly became ill. He developed a bowel obstruction. And then previous to his bowel obstruction, he was so healthy, or thought to be so healthy, that he was offered a Whipple. But once he developed the bowel obstruction, the gastroenterologist and the surgeon thought that maybe a palliative stent would be the most logical thing. He agreed, and then, although it was supposed to be uncomplicated ERCP type of procedure, he became septic that evening and died thereafter. It was hard because I was his medical POA. He had designated me as his medical PA, and he asked me never to make him DNR.
So it was pretty incredible that I allowed for a long time chest compression CPR.
He was on 3 pressors. Of course, I knew he was dead or dying, but I knew that this was what he wanted.
And so I allowed this until they had many efforts attempting to keep him alive.
As to how to prepare for this chapter, I really don't think that you can prepare, as was stated earlier. But from a practical perspective, I would say if you can have the finances and the designated power of attorney designated, because it's going to come no matter what. And the medical decisions, how they want to be treated, it's so much easier when they have things in place. Like my parents had already a plan in place where they would be cremated and they had their urn selected and a burial spot preselected, and that made things much easier in terms of knowing how to manage their death. I would say the finances are an issue, especially if you have conflicts with siblings, and to this day we still have a problem with one of our siblings who is having some issues with the inheritance agreement and whatnot,
Which is really crazy.
you don't know how people will respond to grief. As Dr. Goldberg said, I was interim chair during the pandemic.
And of course, it's all occurred as I was an executive officer and I had to rely upon my vice chairs quite a bit. And of course, I thought about leaving and going to live with
My parents in Philadelphia, but I never did. I just had to keep going back and forth about twice a month, which was really hard. And it was hard to leave my institution as well during a time when everyone needed me and we were called to emergency meetings. It was difficult. The only saving grace was that there was the virtual option for all of our meetings and was somewhat mandated for guilt. I would say that I felt a lot of guilt during the episodes because when I was away from my institution, I felt guilty that I wasn't there. When I wasn't with my parents, I felt that I should be with my parents, etc. I think those are the main things. I would say that balancing being a doctor and just being a family member is really hard when it comes to it, and especially when they're
involving you in decisions and then having another sibling who doesn't trust.
medical doctors, despite her lack of medical background.
And it was very difficult.
I must say, but as stated before, really just trust the providers that are caring for you and just be a daughter.
Thank you so much, Dr. Kaji. That I cannot imagine what these last couple of years have been like for you. So I really applaud you for being willing to share since it's so raw, given that it's been less than a year since your father has passed away and just over a year since your mom passed away. So I can't thank you enough for really being willing to share with the community such a deeply painful time that is so recent. And now I want to just ask the audience if they have any particular questions. Feel free to unmute. Otherwise, I have some questions, but would love to hear from all of you if you have questions for our amazing panel of speakers. What I'd love to know is just how to deal with self care. We all talk about wellness. Dr. Ahmed is very interested in wellness, I think, as part of her career pathway. Do you or anyone else have particular advice? Because obviously it's such an intense period that you don't know how long this is going to go on for. How do you self care? I feel like you want to relish all of that time, but I could see that you can only be a provider and a caregiver if you yourself are getting rest and things like that. So maybe Dr. Ahmed, do you have particular tips being a wellness expert?
I have to say, for someone that is so interested in wellness, during that time, I struggled with it. I have to say, I really focused a lot on my family, and it involved a lot of travel for me as well. So I feel like I was living out of a suitcase and I was trying to make it all possible. I was trying to make everything work and make it all happen somehow. And I think that the tips that I would say looking back, I'm definitely making up for it now and focusing on myself a lot. And I'm very grateful to be able to do that. But I think the tips would be to kind of really take sort of moments of like mindfulness no matter what you're going through, and just taking pauses as much as possible to reflect, and whether it's spirituality, meditation, or anything, that just to take some time away and just be able to just sort of sit even amidst the chaos and just taking that time. I think that other things, like if you have hobbies and passions that you love during those acute periods and that chaos, it may not be possible to do them the way you were doing them before, but in some way, whether it's just a little less or once a day, and then it goes to every month, somehow keeping in touch with that passion or that hobby if you can.
Thank you so much. Dr. Goldberg or Dr. Kajani, any other words of wisdom on wellness?
I failed completely at self care, but I did try to just keep reminding myself that I'm not going to be able to care for my mom, my dad, or anyone else, or my faculty, or the residents, or any of the patients in front of me with COVID if I were sick. So I did try to continue to do things like exercise or eat healthfully and that type of thing. The one thing I do like the taking some moments, and I would say that the plane flight, despite it being a pain and it was 5 hours, and I took so many red eyes when there weren't red eyes, and I had my eyes open. I love movies. It was great that I couldn't use the phone on the airplane, and internet connectivity was spotty, and so I would try to watch a movie, which would take me away for about 2 hours.
I'll share. I think my key wellness thing was being able to step away from everything else I was doing and just really immerse myself in my mom. And we spent a lot of time like listening to her favorite recordings, which every time they come on now are now just a beautiful reminder of that time we had together the last 6 weeks of her life. So I think knowing that these are memories being made, and more you can be present by putting the other things away. And I want to acknowledge, I was attending physician in a leadership role at the time that my mother was very sick. So, it involved putting a pause on my studies, but I definitely didn't have the multifaceted role and with all the people dependent on me that I have now. So, but those memories, those 6 weeks, it's almost everything I remember of my mom. So when I think back to my mom, it was like 90% those 6 weeks. So I can't imagine if I hadn't had that time.
Yeah, thank you. Just looking at some people are writing things in the chat. So Merle Carter's, thank you so much for sharing your stories. You're heroes to me for being able to talk about it without tearing up. Although I think I'm tearing up. What strategies do you have to being able to keep it together, quote unquote, when speaking about these difficult things?
I'll just say it. I haven't actually spoken about this publicly, and I was worried about tearing up coming here, but I also knew it would be okay. This is a hard topic, and I have a lot of pride that I was able to make that right decision at a really young time in my life and really pause everything else. And for me, it's much more distant than the two other speakers here, but I think it's just really shaped my life. And I take a lot of strength in the fact that, like, yes, my mom died and she wasn't there when I gave birth and couldn't see my kid and couldn't see me get married and all these major milestones. But I don't know if I would be here in this exact position if it wasn't due to that really impressionable period of life that I had with her. And it's brought with it so much good. And both she and my father really role modeled how to be with your children when you're ill and not in your best space. And I think that I've taken a lot from that experience too, about how to parent and with transparency, and also allowing your more adult kids to take on responsibilities and face the truth and grow comfortable with the truth. And yeah, so I think taking away a lot from that experience.
I think for me, what really hits me is I feel like even though my dad he's such a loving person, he was such a tough person. And I think his spirit sort of in his journey and what he went through and how he overcame and made a career in America, having been an immigrant. And it sort of instilled in me this strength and power to feel like I could get through whatever comes my way. And I think that, being able to have have had time with him as well. And even though, it's never enough. And thinking about that, it's like those things do sit with me. And I feel like I've had a lot of reflection on everything, but it's the strength I think that he instilled in me that helps me and makes me feel empowered to want to share his story and keep his legacy going and sort of letting his voice live through me as well. And I think it just sort of empowers me a lot.
I would say that I haven't taken the steps that Dr. Goldberg and Dr. Ahmed have by becoming major leaders in geriatrics and palliative care, but it has made me a more compassionate, and my interest in even just making my first step in joining HM was prompted by my experience with my parents. And I can tell you that I'm far more understanding when a patient, for example, the other day just said to me she's unhappy with the nursing home that she's at. And I completely understood, because I remember when my mom was in a nursing home, one nurse was taking care of 30 patients and she wasn't giving the medications to my mother. And I just said, I'll apply the cream if you allow me to, and I'll just take it and do it. I completely understand Dr. Ahmed, and also Dr. Goldberg must also have this too, where my parents were both Japanese immigrants and they came here when they didn't speak English. They both got their doctorates and became tenured professors, which is really amazing. I don't think I could have had that courage at age 23 or 24.
There's one more question in the chat just about the different responses of family and friends of the dying person, which is helpful insight. And the person wondered whether those initially detached or those who didn't want to talk about it come around and later on want to, and if that knowledge can be helpful in the moment.
I will say my siblings both regret not being more involved when my mother was dying. There's an incredible amount of regret and a lot of unprocessed grief there. And I think it took them much, much longer to get to the point where I was almost immediately after she died, because I'd been there on that journey. With that said, I don't think anything I would have said in that moment would have changed their mind. And I will say my mom is from a family with 7 siblings, and we did not reach out to all of her siblings. And when it became clear she was going to die within the next week, and there was a lot of anger directed towards us after that point in time. So I think if I could do everything again, some advice I'd give is reach out to people that you think your mother, father, family member would really matter to, and let them know that no pressure, you're not needed for caretaking, but we're facing the end here soon. I wish I had communicated that better. And at that point, I think we were just really about making it through ourselves and being there for my mom. But I do wish I had taken that step.
In my family, so I'm the youngest of 4 siblings, and my sister and I handled it all very differently. Even though my sister and I were probably the most involved of the siblings, my sister didn't really want to talk about it at all. So she handled, whereas I was talking about it a lot and felt comfortable talking about everything. I was trying to put myself in her shoes, and she's not a clinician in healthcare. So I kind of wondered, is there something like, how is it so vastly different the way we're handling it? But it's interesting to watch as the time went by. She started talking about it more, and it just made me realize everyone processes grief differently, extremely differently. And your experience and unique relationship with the family member, the parent, can probably impact that experience a lot, I feel like, and that unique relationship. But just watching over time, it has changed for her, and I feel like she's talking about it more, but it was just very interesting to see how everyone handles grief differently.
Thank you. I know we're at the end of the hour, and I just really want to thank everyone for joining us. I don't think I've ever been to an SAM webinar where, I wanted to cry half the time, but I just really want to thank our speakers for such amazing, authentic, poignant, and just being real and being vulnerable. Answer the question before of how do we keep it together? I don't think we always have to. We're human. And this is probably the hardest things we'll have to go through is watching our loved ones pass away. I think it's okay. And I would hope that I speak for everyone in the community that if SAM or in particular AGEM, that hopefully we can reach out to each other in these times of need because it's something we can't prepare for and it will be hard for all of us. So thank you. I do want to make a plug for all of those who are not part of AGEM is that we are really trying to increase our membership. So if you want to learn more about caregiving and issues related to geriatrics, because we're all aging, please join because I know we're really trying to increase the membership to 300, right, Liz? We're desperately trying to just because I think they're changing.
We're very close. It's free to join another academy. We would love to have all of you join.
Yes.
What number are we at?
We're about 220. We need to get to 300.
But thank you. And I really just can't underline or underscore enough how powerful your stories are and for you to show such resilience and to use, even just to present here today to really serve our community has been such a gift. So thank you again. And if you have any questions, I'm sure we can get questions to our speakers if necessary, and you can reach out to Melissa or any of us. Thank you. Thank Dr. Kaji. Thank you, Dr. Ahmed. Thank you, Dr. Goldberg. Simply incredible and powerful stories, and we really appreciate your willingness to be so generous to share it.
Thank you. Bye, everyone.